So today we'll be briefing you on what is the meaning of allergic diseases and what we mean by allergic tendency. I'm Dr. Revathi. I work for Medstar Hospital, Sahakarnagar, Bengaluru, and I am a consultant allergy physician as well as pediatrician. So to start with, what is allergy? So allergy is nothing but it's an exaggerated immune response which happens to any innocuous, that is even harmless substances in the environment. So responding to harmless substances is something which is not normal. Immune response is supposed to happen only against bacteria, fungi and such agents. But here response even occurs to normal substances. So this occurs only in a few genetically predisposed individuals. And these responses occur to even substances such as pollens, house dust mite particles, fungal spores, or even sometimes in cases of food and certain drugs as well. So the individuals with genetic predisposition who respond like this to even harmless substances are called as are supposed to be having an allergic tendency. In medical terms, we call that to be a atopy background. So if we notice that the symptoms, how they present is they have excessive sneezing, some of them have nasal itching, they have watering from the eyes, and then they have eye redness, and they have excessive eye itching in the eyes, and some of them have a skin rash with the irritation and redness of skin, and some have bronchial symptoms like cough, breathlessness, wheezing episodes. So they present differently depending on which is the organ system being involved. So here, what I would like to emphasize is these individuals who are hyper-responding or the immune system is hyper-responding, who present with these symptoms, they are not contagious to others. They don't transmit the disease to others. It is their body's response is such a way built. And if you see, they have other colleagues in the workplace or they have the family members who are living in the same atmosphere, and rather they don't respond the same way to these harmless substances. So this is basically the particular individual's hyper-responsiveness to these substances. So this is basically because they produce a lot of IgE in their body, and this IgE antibody is not a normal response of all other individuals. So when there is a high IgE antibody being produced to even harmless substances like pollens, like house dust mites, like your fungal spores, and then the food antigens and certain drug antigens, and then these create more trouble. So these IgE are going to be in the lining of most of the mucosal layers like the nasal, in the gastrointestinal tract, in the respiratory tract, in the skin. So when again these substances come in contact either with the inhalational route or the ingestion route or in the skin contact, they trigger the excessive response.